Hey, Dr. Michael here again. Just wanted to touch base briefly on the subject of pingueculum. By way of background, a pingueculum is a benign bump and can be looked at as a precursor to pterygium, where it's still on the white part of the eye. And when they grow further and they get onto the cornea, then we just change their name to a pterygium. The question I commonly get from referring doctors is, will I do surgery on a pingueculum? And the answer is yes. I tend to be a little more hesitant and have a higher threshold to pull the trigger on surgery, but I've had quite a few people over the years with a lot of irritation from a pingueculum, and some that would fall into the category of what I call tortured souls, where it's just miserable from them. And we did surgery. I didn't think much of the surgery in terms of it was technically pretty easy to do, and they had a huge amount of relief. So I think my fear with pingueculum patients, quite bluntly, is I don't want to neglect them. There is a balancing act when you're trying to determine whether surgery is warranted or not, and you don't want to be too aggressive, but at the same point, you don't want to neglect people and say, well, it's not bad enough to need surgery, when they have a lot of irritation and are miserable from it. So to answer the question, will I do surgery on a pingueculum? Certainly, the surgery is basically just like our pterygium cases. If anything, the recovery is easier, and they're actually very satisfying cases because people get a lot of relief from it. I will do those cases for cosmetics. Again, I have some hesitation to do so, but if somebody is miserable or the cosmetics look really bad and I can fix it for them, yeah, sure, we'll do surgery for them. So just a note on that.